Skull Project Part 2. We're going to start today with marking the origin and insertions of the muscles that we're able to on the skull. We have two cervical muscles, the sternocleidomastoid, which originates on the medial portion of the clavicle and superior and lateral surfaces of the sternum, so we can't mark those, but we can mark the insertion in blue. Insertions are blue, and that is going to be here on the mastoid process. I've kind of started it a little bit already. So we're just going to run that blue line across here for that insertion. Okay. And the sternocleidomastoid muscle is one that rotates your head to the opposite side and is innervated by the 11th cranial nerve. The only other one that we need to learn of the cervical muscles is the trapezius, which originates here on the occipital bone. And in particular, it originates on the superior nuchal line, which looks to me, reminds me of the M, like McDonald's, right here. So it's going to insert across this area of that occipital bone. It's going to insert on the lateral third of the clavicle and portions of the scapula, and the action of that is when you shrug your shoulders. We are going to move on to the muscles of facial expression. We're going to start with the scalp region with the epicranial muscle, or the epicranius as it's sometimes called. Again, our origins are red and insertions are blue. The epicranius or epicranial muscle has two bellies. It has the frontal belly here, and then it also has the occipital belly on the back side. And here are the marks for that right here. It's hard to see that. So we'll be painting those bellies. The frontal belly, the origin is on what's called the epicranial ponerosus, which is just a large scalpel tendon over this most superior portion of the skull where the frontal bone and parietal bones meet. So it's just a large tendon there. So origin, again, is red. I'm just going to mark it on the one side of the skull, although there is, it is on both sides there. It extends. And then we are going to do the insertion. It inserts into skin tissue, and that's what makes the facial expressions, is because that skin is freely movable when the muscle inserts on the dermis of that skin tissue. So the insertion is going to be, I started it here, it's going to be through here. So it goes the skin tissue of the eyebrow as well as the root of the nose, and again that's on both sides. This muscle comes down in kind of a V-shaped look like this. And the occipital belly, the origin of this one, so we can get our skull to stay still here. The origin of the occipital belly of the epicranius is the occipital bone and the mastoid process. So it is going to be this one here is our origin. So it's going to be coming across this way. And just a little bit onto that mastoid process. It doesn't go, all the way down onto there. So just a little bit onto that mastoid process. And the insertion of the occipital belly is that epicranial ponerosus again, which on the back side is right about here. So that's just going to again extend all the way across that skull. So I think I'm just going to paint it on the one side. You can paint it all the way over, but I just don't want it to get in the way of our nerves and stuff we do later. So maybe we'll just paint that one halfway. Okay. Next we'll move on to the muscles, facial muscles of the eye region. Muscles of the eye region, we're going to start with the orbicularis oculi. The origin is the orbital rim here, and then also the nasal process of the frontal bone and the frontal process of the maxilla through here. So these, and then the insertion is going to be the skin tissue, again in blue, the skin tissue at the lateral area of the eye, so right here on the lateral eye region. And some of the inner fibers do completely encircle the eye as well. The action of the orbicularis oculi is to close the eyelids. It also offers protection of the eye and works with moisturizing the eye as well. The second muscle that we are going to learn in the eye region is the corrugator supercelli muscle, and its origin is the supraorbital region here, and then it's going to pass superior and lateral and insert into the tissue of the eyebrow, which is shown here. And the action of that is to move the eyebrows in and down, like when you're upset or angry. Next, we'll move on to the muscles in the mouth region, down here. Okay, next we're going to talk about the muscles of facial expression in the oral region, the mouth region. The first one we'll talk about is the orbicularis oris, which originates, kind of just encircles the mouth. I've only marked it on half so we can save room for some other anatomy we need to add on the other side, but it does encircle the mouth, and then it's going to insert on the skin tissue at the angle of the mouth, which ideally would be here, but we don't have lips, so I'm just marking it here as a dot. And it also inserts on the philtrum of the upper lip there. And the action is to close the lips, purse the lips, grimace, pout, and kiss. Next we have the buccinator, which is going to originate here on the alveolar process of both the maxilla and the alveolar process of the mandible. And that, and also the pterygomandibular raphe. So that is the third area, and that extends from the hamulus, the pterygomandibular raphe, extends from the hamulus down to the mylohyoid line. And that's going to be a significant structure as a hygienist, because we're going to be using that for an anesthetic marker to know where we're going. And then the buccinator is going to originate from those 3 points, and then it's going to insert at the skin on the angle of the mouth. So I just kind of marked that there. And then I like to kind of draw a line just so I know that's the buccinator. Kind of connect those points. That helps me anyway. And the buccinator is going to pull the angle of the mouth laterally, shorten the cheeks horizontally and vertically. So its main function, it keeps food pushed back on the occlusal plane. So it's going to help those muscles of mastication. It's also important for suction and suckling, so in infants, and it's also known as a trumpet muscle, so it's kind of expanding those cheeks out. Next, we're going to move to the risorius muscle, and it originates on the fascia superficial to the masseter. Well, we don't have our masseter on here, but our masseter muscle kind of runs through here, so we're going to mark the risorius as here for origin, and then it runs kind of medially and inserts on the skin tissue again at the angle of the mouth. The action of the risorius is grimacing, stretching the lips laterally, and it usually contracts with the platysma, which is going to be here. It's that big muscle that kind of runs down the neck. And next we have the levator labii superioris, which originates here on the infraorbital rim of the maxilla, and it passes inferiorly and attaches to the skin tissue here of the upper lip. So skin tissue of the upper lip. And that one is one that elevates the lip. So it pulls the lip up kind of in that Elvis kind of sneer, if you've ever seen that. Next we have the levator labii superioris alacunasi. This is a cute little muscle. And so he is going to start right here. And that is on the frontal process of the maxilla. So we have infraorbital rim for the levator labii superioris, and then we have the frontal process of the maxilla for the levator labii superioris alacunasi. So here's our origin, and this one's a fun one because it also inserts on the skin tissue at the ala of the nose, and then again down here on the upper lip. So this kind of tells us right away what this does is that it dilates the nostrils. So you can see how that muscle would pull that nostril out, kind of those flaring nostrils when you're mad. Next we're going to move to the zygomaticus major, and it is going to originate on the zygomatic bone, and you can see it's lateral to the zygomaticus minor. It runs anteriorly and inferiorly, and then it's going to insert on the skin tissue at the angle of the mouth. So it's inserting at the angle of the mouth like many of the others. Its job is to pull the angle of the upper lip up and laterally. So that's one of our smiling muscles. And it contracts together with the orbicularis oculi. Next we have kind of the little brother here, the zygomaticus minor. It originates as well on the body of the zygomatic bone, but again it's medial. It's medial to the zygomatic major, and it's going to insert into the skin tissue of the upper lip. So not the corner of the lip, but of just the upper lip. And so it's adjacent to the levator labii superioris. So they're just kind of neighbors. They're kind of like the little brother. It's going to elevate the upper lip and assist in smiling, so it's kind of the helper muscle. The levator anguli oris, which is this little guy here, it originates in the canine fossa. So this one's actually going to be deep. It's going to be underneath the zygomaticus major and minor, which makes sense because it's in that deep fossa there. So it's going to originate, levator anguli oris is going to originate in the canine fossa of the maxilla, and then it's going to insert into the skin tissue at the angle of the mouth. So again, the corner of that mouth. Its action is to elevate the angle of the mouth. So it could be kind of helping with that Elvis kind of sneer, and assist in smiling. Oops. And next we have the depressor. So we're going down to the bottom area here onto the mandible. So the depressor anguli oris, it originates on the lower border of the mandible, and then it is going to insert in the skin tissue at the angle of the mouth, and its action is to depress the angle of the mouth. So this is a frowny muscle, which makes sense. It's on the bottom and it's pulling it down. Next we have the depressor labii inferioris, kind of the middle one here, and it originates on the lower border of the mandible, passes superiorly, and inserts on the skin tissue of the lower lip here. And again, its action is to just depress the lower lip, kind of depress the lower tip. And then we have the mentalis, which originates near the midline of the mandible and inserts on the skin tissue of the chin, not the lip, but the chin. And this raises the chin and protrudes the lower lip. So this is what gives that lower lip a lot of its strength, like patients that push out dentures, or when you're trying to clean, the mouth kind of forces you out. As a hygienist, this is your least favorite muscle. And then lastly, we have the platysma, which originates on, kind of down here on the superficial skin of the clavicle and shoulder. So we can't really show that because we don't have those bones. But it's going to pass anteriorly, and it's going to insert on the lower border of the mandible and the muscles surrounding the mouth. So this is a big muscle. This one is going to raise the skin of the neck and pull down the corner of the mouth. So this is the one we said works together with our Isorius. So these two kind of work together. Okay, so that concludes that second family of muscles, and next we'll be moving on to muscles of mastication. Our next group of muscles are the muscles of mastication. There's just 4 that we're going to learn. The first is the masseter, and it originates up here on the border of the zygomatic bone, and then also there's the deep head that kind of extends into this medial area as well. But just for your knowledge, just here on the edge of that zygomatic bone. And then it's going to pass inferiorly, and it's going to attach here just on the angle of that mandible. So kind of where that curves, that curve of the mandible, the angle. And that is going to, the main action is to elevate the mandible, which makes sense. It goes from here to here, so it's going to lift that mandible. The next one is the large fan-shaped temporalis muscle, which originates in this entire infratemporal, or temporal fossa, excuse me, the entire temporal fossa, and it is going to insert on the coronoid process right here of the mandible. So from here to here, more on that medial surface there. And it also is going to elevate the mandible, but because of its position, it can also move the mandible backward, which is important when you're closing the jaws. The last 2 are the pterygoid muscles. The medial pterygoid muscle is going to originate from the, I'll have to flip this over, medial surface here of the lateral pterygoid plate of the sphenoid bone. So the medial surface of that lateral pterygoid plate, and it's going to pass inferiorly and posteriorly and laterally, and it's going to insert here on the angle of that mandible. So, and its main purpose is also to elevate the mandible. So that's, most of them, that's their major purpose. However, the lateral pterygoid muscle, which is our last one that we're going to talk about, it's going to be entirely in the infratemporal fossa, which is this area here. So let's see here if we can move that a little bit so we can see. So right here we have, actually it has 2 heads. The superior head is going to come from the inferior surface of the greater wing of the sphenoid here, and then the inferior head is the lateral surface of the lateral pterygoid plate of that sphenoid bone. And then these two heads are going to pass posteriorly, and their insertion, if we put this mandible back up here, the insertion is going to be the pterygoid fovea, which is kind of a triangular shaped area here on that inner surface of the mandibular condyle. And then also the most superior fibers are going to insert into the TMJ capsule, which I marked here. So 2 origins and essentially 2 insertions there. And this one is special because it doesn't extend downward to the mandible like the others. It's responsible for protrusion of the mandible, so sticking it out, and it pushes it down, depresses the mandible. And this one is also responsible for lateral deviation of the mandible, which is that movement side to side, which we'll be using to check the health of the TMJ and the TMJ exams. So that concludes the masseter muscles, the muscles of mastication, and next we'll be moving on to the hyoid muscles. Our next group of muscles we're going to discuss are the hyoid muscles. These muscles assist in mastication as well as swallowing. The first muscle we'll discuss is the digastric, and it has two parts or two bellies. The first part, or the anterior belly, if we can imagine there's a hyoid bone here, it's going to originate from the intermediate tendon of the hyoid, and then it's going to pass superiorly and anteriorly to insert on the symphysis, on the inner portion or inner surface of the mandible, so right around here. And the posterior belly is going to arise from the mastoid notch, which is a notch that your skull shows fairly well, that I've marked here. And it's just medial to that mastoid process on the temporal bone. This is going to originate, the posterior belly is going to originate in this mastoid notch, and it's going to pass inferiorly and anteriorly, so down into the front, and it's going to attach on that intermediate tendon of the hyoid bone where the other anterior belly begins. So it forms kind of a V shape, the digastric muscle. Next, we'll talk about the mylohyoid muscle. The mylohyoid muscle originates from the mylohyoid line on either side, so it's two muscles that join as they come medially to the front, and these are going to form the floor of the mouth. The posterior fibers are going to insert on the hyoid bone, so these posterior fibers are going to insert on the hyoid bone. The action of the mylohyoid is to elevate the hyoid, it's going to depress the mandible, and it's going to elevate our tongue. The stylohyoid is anterior and superficial to that posterior belly of the digastric, which runs from that mastoid notch to the hyoid. And it goes by its name, so stylohyoid, so it's going to run from that styloid process of the temporal bone. It's going to pass anteriorly and inferiorly, so down into the front, and it's going to attach to our imaginary hyoid bone here. The geniohyoid is the last one in this family. It's deep to the mylohyoid, which is here, and genio corresponds with genial tubercles, so it makes that one a little bit easier to remember. The genial tubercles are these little bumps here, those cute little bumps on the inside of the mandible, kind of right at the midline there. So it runs from those genial tubercles, and it's going to pass posteriorly and inferiorly, so down and back, and attach to that hyoid bone. We will not be able to do on our skull project anything with the infrahyoid muscles because those all attach to the hyoid and are, below where our skull is. So we don't have any attachments on the skull itself for the infrahyoid muscles. So we'll be working and doing some exercises and projects with those muscles in class. So the next muscles that we will discuss are the muscles of the tongue. Okay, we're going to go ahead and talk about the muscles of the tongue. There are the intrinsic muscles. Those are inside the tongue, so we'll be doing an in-class exercise to learn more about those. The extrinsic muscles, there are a couple origins and insertions that we can mark on our skull. The first one being the genioglossus, which just like the geniohyoid is going to originate on the genial tubercles. And just like the name says, glossus is tongue, so it's going to insert on the tongue and mix with those intrinsic fibers of the tongue. And it's also, the inferior fibers are going to come down and attach to the hyoid bone. That muscle is going to protrude or depress the tongue. So stick your tongue out or push it down. The next one is the styloglossus, which runs from the styloid process to the tongue. And again, that's kind of shares a similarity with the geniohyoid and genioglossus because we have our styloglossus and stylohyoid that are both going to be here, so kind of similarities there. The styloglossus passes inferiorly and anteriorly to insert on that lateral surface, border of the body, base, and apex of the tongue. and its main action is to retract the tongue. So the styloglossus, because it is further, it's attached to this more posterior surface here, is going to pull that tongue back. Lastly, the hyoglossus, again, we don't have any areas on our skull we can mark because just like it says, hyo would be hyoid. So it's going to originate on our hyoid bone down here, and it's going to insert on the lateral surface and body of the tongue. And because it is down here, it's going to pull, the job is, or the action of that is to pull the tongue down. So next we're going to go ahead and talk about the muscles of the pharynx. Will be our next section. Next set of muscles that we'll be discussing are the muscles of the pharynx. They are essential for speaking, swallowing, and for the function of the middle ear. The first of those muscles of the pharynx that we're going to discuss is the stylopharyngeus, which, just like its name, it says it originates on the styloid process. These paired longitudinal muscles, so there's going to be, of course, one on either side, they're going to insert on the lateral and posterior walls of the pharynx, which we don't have shown here, but you do have some good visuals in your textbook. Next, we have the pharyngeal constrictors. There are the superior, middle, and inferior pharyngeal constrictors, and they form the lateral and the posterior walls of the pharynx. The origin of the superior pharyngeal constrictor is up here with the pterygoid hamulus and the pterygomandibular raphe, which runs from that hamulus down to the mandible, as we remember, and also the mandible. So 1, 2, 3. So hamulus, raphe, mandible. Hamulus, raphe, mandible on that superior pharyngeal constrictor. The middle pharyngeal constrictor originates on the hyoid bone and the stylohyoid ligament. And then the inferior pharyngeal constrictor originates on the thyroid and cricoid cartilage of the larynx. So again, those aren't ones we can mark on the skull. And all of these overlap, and then they insert on the median pharyngeal raphe, which is a fibrous midline band on the posterior wall of the pharynx. The action of the constrictors is to drive food inferiorly into the esophagus when you're swallowing. Next, we'll discuss the muscles of the soft palate. There are 4 that we're going to discuss: the palatoglossus, palatopharyngeus, levator villi palatini, and the tensor villi palatini. So the palatoglossus originates, just like it says, the palate. So we have our origination here on the median palatine raphe. So I've marked my little red dot here. And its insertion is going to be glossus, so on the lateral surface of the tongue, which we don't have here, but so palatoglossus. So starts on the palate, inserts into the tongue. The function of the palatoglossus muscle is to elevate the base of the tongue, depress the soft palate, and it forms kind of a sphincter between the oral cavity and that pharynx. Next, we'll discuss the palatopharyngeus. So this originates on the soft palate, so a little further back, so we can't mark this on our skull because it's not on the raphe, it's actually on the soft palate that it originates. This forms the posterior fascial pillar, whereas the palatoglossus forms the anterior fascial pillar that we see when we look in the mouth, and we'll do more exercises on that in class. The insertion of the palatopharyngeus is the walls of the laryngopharynx and the thyroid cartilage, and the action is to move the palate down and back. So it moves the posterior pharyngeal wall up and forward, and that helps close off the nasopharynx during swallowing, so you don't get that like water up your nose. I think we've all done that by accident. Next is the levator. villi palatini, and it originates on the inferior surface of the temporal bone. So let's roll our skull over here, and I'm just going to pull this mandible out of the way. So I've actually marked these, and I put a little color on these two because we have the tensor villi palatini and the levator villi palatini, just to distinguish the two. So the levator villi palatini, which I've marked as LVP, originates on this inferior surface of the temporal bone, kind of just in front of that external auditory meatus right here. And then it's going to come down and it's going to insert here, where I've marked it in green, on the median palatine raphe. So it runs from here to here. And the function of that, the action, is to raise the soft palate to the posterior pharyngeal wall to close off that nasopharynx again. So again, another important one for not getting liquids up your nose. The tensor villi palatini, this one is kind of a little more complex. It's kind of a fun, I always think of it as the tough guy, the tensor. He's the tough guy, TVP. And he originates here in the auditory tube area, which I've marked with red with kind of a little yellow spot, and also the inferior surface of the sphenoid here on the spine, so a little spine that sticks up. So a couple spots there that it originates. It's going to pass inferiorly, so down, and it's going to pass between the medial pterygoid muscle and plate, and it's going to form a tendon. So it's going to kind of come through here, and then it's going to wrap up around this hamulus and form a pulley. So that's why it's like the tough guy. I always think the tough guy at the gym that's pulling down the weights. So TVP, tensor villi palatini. So he comes from these two areas, winds his little pulley around here, and then he's going to insert over here where I have the yellow on the median palatine raphe. So his action of tensor villi palatini is to tense and lower the soft palate. The last one, which again I cannot show you because it isn't here, but if we can visualize that uvula hanging down here, the uvula muscle is actually is within, so its origin insertion are within that uvula, and its action is to shorten and broaden the uvula to close off the nasopharynx during swallowing. So that completes our muscles.